Welcome to Medical Marijuana and Wellness. Today's topic is Understanding Cannabis as Medicine. With me is Amy Green, RN with MMTC of Florida. Amy, welcome.
Yeah, always wonderful to be here, Mark. Thank you.
So let's talk about cannabis as medicine. First of all, let's talk about the image that people have of cannabis. I know that when people think about cannabis, they think about Snoop Dogg, they think about Willie. Obviously, this is the image that the industry has, but in reality, what we really see in the cannabis world is a lot of patients. You see this in your business, don't you?
Absolutely. Patients range from young adults to seniors, and they are treating everything that you could imagine. We're seeing veterans and athletes, and seriously, a lot of working professionals. Everybody has a different reason for using cannabis, but a lot of people are finding that it has medical benefits for them.
Yeah, and especially veterans, athletes and professionals. It really helps with a lot of different situations. It's really becoming not taboo anymore and increasingly accepted, for treating a lot of different health issues. So cannabis is safe. I think this is one of the most important things. I think a lot of people worry about, you hear about opioids, you hear about different medicines that are out there that literally can kill you. No one's ever died from using cannabis. Is that correct?
That is entirely correct. Yeah, cannabis has no lethal dose. You always give the anecdote of the gentleman who said you had to smoke like 2,000 pounds in an hour for a fatal dose. And you have more problems than just smoking cannabis if you're smoking 2,000 pounds in an hour. So um,
Yeah.
there is no fatal dose of cannabis. There are much more common things that are actually much more dangerous. Obviously, we have alcohol, you have just over-the-counter medicines that are much more dangerous. Gosh, even peanuts are more dangerous than cannabis.
Yeah, I've heard actually the cannabis is safer than McDonald's hamburgers. So it's really out there. But I think that's the important thing to understand is that you're not going to die. Now, if you do take too much cannabis, you can get drowsy, you can have some effects, some side effects. But the one side effect you're not going to have is you're not going to die. And I think that's the important thing to understand. Now, let's talk a little bit about what is the components of cannabis. Can you list those for us?
Yeah, certainly. So there are three main components of cannabis. You have the cannabinoids, and there's several of those that people already know. So the ones that people know are going to be THC, which is the psychoactive part of the cannabis plant, and then you have CBD, which is another cannabinoid that's the non-psychoactive part of the cannabis plant. There's also many, many minor cannabinoids. They just don't appear in large amounts in cannabis plants. Additionally, you have terpenes. Terpenes are what give cannabis its smell and its taste. So these terpenes are actually also bringing in a lot of health benefits as well. So, for example, linalool, also found in lavender, has that sort of sweet smell to it. Linalool is actually great for relaxation. And additionally, you have flavonoids. Flavonoids are similar to terpenes. They're going to contribute color, aroma, and taste to the cannabis plant. But again, they're also going to be bringing a lot of medical benefits, such as an antioxidant, anti-inflammatory, and possibly even disease prevention.
Right. And really, the terpenes and the flavonoids are some of the keys to the medical benefits of cannabis and really make cannabis medicine when you really think about it. When you take a look at cannabis as a whole, it has a number of medical properties. I mean, they found that this particular plant has 450 medical properties. One of the, I think, the most potent product with respect to health benefits, but it also has some other side effects, or some other, I should say, some reasons for using it. Can you list those for us?
Yeah, certainly. So a big thing about cannabis is when you put all of those different parts of the plant together, so you have your cannabinoids, your terpenes, and your flavonoids, you end up with something called the entourage effect. That is how those different compounds work together to provide medical benefits.
Yeah. And what's interesting is I know this little diagram here on the right, this little gentleman with all the little different conditions. This is a study that was done by Normal that shows that in this particular case, they listed 77 different conditions that cannabis addresses. It's really interesting. The 120 cannabinoids and 100 terpenes are very effective to helping people basically get their life back. One of the questions I get asked all the time is, what's the big deal about cannabis? And what I find very interesting is we all have a nervous system, and we all are aware of our nervous system. We know that if we hurt our finger or hurt our knee or something like that, a signal is sent through our nervous system up to our brain, says, Houston, we have a problem. And then your body then tries to manage it. What's interesting is for a lot of years, we didn't know, we were trying to study what the body was doing with it. And what happened was when we started studying cannabis, we found the endocannabinoid system, or referred to as ECS. And what they found out was there was a number of receptors, CB1 and CB2 receptors throughout the body. Notice the CB1 receptors are primarily in the brain, in the spinal cord. CB2 receptors are some of the peripheral organs and in our gut. But they found out that these endocannabinoids are what control our memory, our emotional processing, our appetite, our sleep, temperature control. In other words, are we hot or cold? Inflammation, our immune responses. This is how your body basically manages itself. And this was a major discovery, that our body actually produces the endocannabinoids. And that's important. It's important because our body itself is helping to regulate itself through the endocannabinoid system. Can you kind of expound on that a little bit, Amy?
Certainly. So when we think of endocannabinoid system, endo meaning inside, so this is naturally occurring within our body. And so our body, therefore, is naturally producing cannabinoids that interact with these receptors. Again, you said the CB1 receptor primarily located in the brain and the spinal cord, and then the CB2 receptors are going to be more in the peripheral organs of the body. CB1 and CB2 are just two of many different receptors that cannabis can interact with. And all of these different receptors are going to have slightly different jobs within the body. For example, the 5-HT receptor that cannabis interacts with is a serotonin receptor, and that's actually responsible for digestion, blood flow, and breathing. The A2A receptor is inflammation and coronary circulation. You have VR1, that's body temperature and pain. And then the GRP55 is responsible for blood pressure. So you have endocannabinoids interacting with many different systems in your body to help bring a sense of balance and a sense of equilibrium to your body, because that's what your body is always trying to do, is get back to that balance, that equilibrium.
Right. And this really is a breakthrough for the medical community because it helps explain a lot of how the body functions. As you mentioned, your body produces the endocannabinoids, and then the cannabis plant produces phytocannabinoids. What's the relationship between them?
Yeah, so endocannabinoids and phytocannabinoids are structurally exactly the same, meaning that when we are introducing phytocannabinoids from the cannabis plant into our body, we are supplementing the naturally occurring system that is in our body.
Yeah, and that's kind of important because I know, for example, like I'm a senior citizen, and I know that I don't produce endocannabinoids like I did before, or as fast as I did before. So having some phytocannabinoids in my body, in essence, is recharging my battery or giving the batteries of my body the energy it needs to be able to produce it, to do its function, to really keep me in what they call homeostasis, or keep me in balance. I think this is important because now what we found out is this is a very natural way that the body can really help itself heal. And we've known about this really only the last couple of years, but for thousands of years it's been practiced, right?
Certainly, yeah, we have records of cannabis being used back in ancient times, and we are just now, within the last 30 years, figuring out why it works in the body and how it works in the body.
Sure.
So that research is new, but the benefits have been seen for thousands of years.
And one of the other things about this is because it's a natural process within your body knows where it has a problem. So if you're being treated for cannabis, for example, let's say you're being treated for arthritis, and yet you find out that you have another problem like pain in your knee or something like that, it'll actually address both of those conditions. Is that correct?
That is correct. Yeah, your body is going to be sending chemical signals all throughout your body, and that's really what the endocannabinoid system is. It's a chemical signaling system in your body, and might not realize it, but that is going on in the background all the time. And so our body is going to use those phytocannabinoids from the cannabis plant where it sees fit. It's going to send those where the body is signaling it to go.
Yeah, and this is again all part of that entourage effect that we talked about. So really, what's the bottom line? I know that one of the bottom lines we talked about is it's safe. You know, you're physically not going to overdose from it. You maybe have some negative side effects, but those are easily counteracted. But also, Amy, you might comment on something like you're in control because this is important. You control the dosage and how often you take it.
Absolutely. Especially when I'm using or working with new patients, I like to explain that they are in control of this process. The dosing is going to be based on how they feel using the process or using the products. So if they feel that the dose is too high, okay, then the next dose, let's lower it. Let's bring it back down a little bit until you find that spot where you're comfortable without negative side effects.
Yeah, and I think it's important to point out that cannabis is very personalized. It's very much like alcohol or very much like caffeine. People have different tolerances and different ways of reacting to it. I know I have friends who have one drink and they're done for the night, and others that'll drink the whole bottle and just get started. Same thing with cannabis. Your body will tell you how it reacts to it. It will react positively to it. The question is, how much do you have to take and what's your therapeutic dosing level? And that you can find out through a process called dosing that we use in the medical cannabis world. But you're in control, and I think that's the important part of it. Also, really, you can't get addicted to it. I mean, there's no addictive properties like you find in opioids, heroin, and tobacco. You've seen that in your practice, haven't you?
We have, yeah. So we have thousands of patients that are using medical cannabis. And I have had personal interactions with lots of those patients that are telling me that they're able to stop these long-term medications that they've been on with the assistance of the physician that prescribed them that medication. But I've never had anybody tell me that they have not been able to stop cannabis. It is not addicted. Pardon me, it's not addictive. And if somebody wants to stop, there's not going to be any withdrawal from stopping suddenly, nor will there be any cravings for the actual substance. People may have a psychological need to not be in pain, to not feel anxious, to feel relaxed, or to help them sleep. But that is not necessarily the same as an addiction. That is a kind of a physical need for the relief that the product provides.
Yeah, I know. I have 7 herniated discs in my neck, and I take medical cannabis to basically reduce the inflammation as well as the pain. And if I don't take any medication at all, my pain level can be a 7 or an 8. But using medical cannabis, I keep my pain level below a 1. I take about every 6 to 8 weeks, I take a day or two off just to let my body reset, let the natural endocannabinoids in my body begin to do its job because sometimes they can get lazy. But I'm not addicted to cannabis. But what I'm addicted to is getting rid of the pain because after about a day or two, my neck taps my shoulder and says, if you don't do something pretty quick, I'm going to let you know I'm here. And it's something that's really interesting because I don't have any physical addictions. When I stop using cannabis, there's no negative side effects other than the fact that the pain comes back. And like I mentioned, my addiction is to get rid of the pain. It's not cannabis itself. And that's what we find with a lot of patients. You see that in your practice, don't you?
That's correct. Yeah. A lot of people are using it to treat a certain condition. And then when they're not able to treat that condition, um, they they want to go back to treating that condition.
Sure. And the other thing about cannabis that's interesting is I had a perception when I got into medical cannabis or I got into cannabis that you had to smoke it. You really don't need to smoke it. There are other routes of administration, is what they call them, or other ways of taking it. Like, for example, tinctures, edibles. Actually, they have you do have your vaping, and you have also creams and lotions that can help you quite a bit. This is important for patients who want to be able to, again, be personalized and make it easy on themselves.
Yeah, absolutely. I really like to explain to patients that this process is all about making them comfortable in the choices that they're making. So if they've never been a smoker or they're a previous smoker and they do not want to inhale anything, that's totally fine. We want them to be comfortable with the products that they're using. And if they're not comfortable with an inhaled product, that's fine. We have lots of other products that they could try, including oral, topical, sublingual, or edible products. So there's a wide range of things that do not involve an inhaled product.
Right. And that includes some of the famous gummies like brownies and things like that, famous edibles that are out there. So really cannabis it's safe, you're in control, you're not going to get addicted, and you don't need to smoke. So Amy, if you want to be able to learn more about medical cannabis, we have our YouTube channel, which you're watching right now. Please feel free to like and subscribe to it. But YouTube/marijuana aware will not only give you this video, but also other videos on how to use it and about the different medical conditions that are out there. And naturally, if you're in Florida and you want to take a look at getting a medical marijuana card, I recommend looking at talking MMTC Medical Marijuana Treatment Clinics of Florida. There's 22 of them in Florida, and they're here to help you. And I think the important part about it is they also help you once you get your card to get your dosing correct and be able to give you information about how to use it correctly. So Amy, any final thoughts?
Yep, as always, I'm going to recommend start low and go slow with your dosing. I recommend keeping a treatment journal to help you figure out what's effective or ineffective. And then just knowing that there's options for products that you can use, but there's also resources that you can check out that are totally free. And we are just here to help you along this journey.
Great. Well, listen, if you're looking at helping you get your life back, medical cannabis is a great option, and you want to explore it, you explore it a little bit further, check out our YouTube channel and also get a hold of MMTC of Florida. Thank you very much for watching, and we look forward to your comments.